Welcome back, everyone, to Diary of an Empath. My next guest is Julie McFadden. She's a hospice nurse and the author of the book, Nothing to Fear. She is not only a trusted voice at the end of life care, but also a social media sensation, which is where I found her. And with her unique ability to demystify death and dying, Julie has gained a significant following on social media where she shares invaluable insights about hospice care, the dying process, and how we can approach the topic of death with more openness and understanding. Julie, welcome to the show.
Thank you. Thank you for having me.
So once upon a time, I actually worked in hospice care. So before I became a therapist, I was in social work and I did hospice care for almost 2 years. I learned a lot about myself. I learned a lot about the grief and dying process. And I learned that it takes a special kind of person to work in this field. So when you think about your mission and what that means to you, what is that?
I think generally speaking, whether I'm working as a nurse or working as an educator on social media, which has kind of happened by accident, my general mission is to just educate people about the end of life and death and dying to help alleviate at least some of the fear, give you some relief around it. Because I really, truly believe, just from my own experience, that education does decrease fear around something that's going to happen to all of us.
It is going to happen to all of us, but it's the one thing that nobody wants to talk about. I'm curious for you. You mentioned getting into social media by accident. How do you go from a hospice nurse to spreading messages online and having this big social media platform? Because that is a very, very unique transition into something really big and important. But how did that transition happen for you?
Yeah, it really does feel like happenstance. My friend happened to be going through his dad dying at the time, and we were close friends, so I was talking to him a lot about what to expect and what he was going through and why this was normal and that wasn't normal, and just different things, like conversations every other day about what was happening with his dad. And he had known me for years, was like, I can't believe you know all this. And like, I didn't know what I didn't know. And I'm just surprised that, like, to hear you kind of like rattle off all these things. You really should tell people this. You really should do a podcast or something where you're educating people about this. And it's kind of like when you're in when you're in this field, you forget that like not everyone knows the things you know. So that kind of got me thinking about that. And I did really love talking about death and dying and educating about death and dying. I did it every day at work. So at first I was like, maybe I'll start a podcast. And then it's just hard. I mean, it's hard to start a podcast and I don't have the attention span. I didn't know where to start. I was like, oh God, I don't know what I'm doing. And then I happened to go home to see my nieces. It was like right when COVID stuff started opening up and people were traveling and stuff. And I went to go home to see my nieces, who were tweens at the time, and everything was like TikTok. It was 2001, almost 2002. Or no, oh my God.
2021.
myself. Yeah. my prime. It was 2021, almost 2022. There we go. And they were doing everything TikTok this, TikTok that. Let's do this TikTok dance. And I was kind of making fun of them about it and just teasing them, but I would do it with them, do all the TikTok dances. And then I got on TikTok to like watch their TikToks. And then I started seeing people like my age doing cool things about like space and gardening and cooking, and TikTok's like kind of addicting once you get on it. So I thought, I'm going to do this. And I really didn't try that hard. I like turned my camera around, made a few videos of me just talking into the camera about things I rattle off every day at work. And by the 4th video in, I went viral. And then like a couple videos later, another one went viral, and it kept kind of just going viral. And I felt like I didn't even address it. I didn't make a video being like, I can't believe. I was just sort of like, well, I guess people are watching this. So I just started like I knew I had like endless things to kind of talk about. And that's how it all started. And it took on a life of its own. It feels like it really
the universe did that. Like the universe put something in your path for a bigger mission. I really believe that people who are meant to be healers will have so many opportunities to take the path that they need to be on if they take the chance. And you mentioned that there's a lot of anxiety that you noticed around death and dying that people are either afraid to talk about, uncomfortable talking about. And in your book, you mentioned the phrase death anxiety and how people generally feel uncomfortable talking about it or even thinking about it. Why do you think that the inevitable of death, we all know it's going to happen at some point. Why is it so uncomfortable for people to talk about?
I think it's just the ultimate unknown. The ultimate, like the there's so many unknowns in the world, right? But this is like the big unknown, like what happens after we die, which I think goes into a lot of like, then why am I here? And will I see people who have died again? There's a lot of questions that come up with it, which can cause a lot of fear. And I really didn't set out. And I think anxiety is just anxiety, generally speaking. I feel like I grew up and live with a lot of anxiety on a daily basis. So I think it can manifest in many ways. One of the things I didn't really set out to do is to help with actual death anxiety. But since I've started the channel, I've received like hundreds and hundreds of messages from people who said they've suffered with like death anxiety, where they tried to get help and get therapy and medications and all these things. And my videos and other people's videos, not just mine, were helping, even which I didn't really set out to do. But I think knowledge can create some form of power and security, even if it's just for a moment. You get those little moments of like let go and release where you don't feel so much anxiety. And I think over time that can help decrease the anxiety. But girl, what do I know? Weird? I don't really know. I'm not a therapist. You know what I mean?
But I'm a therapist and I don't know. And I have okay, I'm going to tell you something weird. I'm only 38. I'm going to be 39 this weekend. It's my birthday. I think about death all the time. I don't know why. I don't know if it's because I got a lot of Scorpio energy. I don't know if it's because I've worked in the field. I'm not sure if it's because I'm just very spiritually connected, but I think about it a lot. It's very weird. And sometimes I do get a lot of anxiety thinking that I am going to die one day. And I often think about my life and the things that I don't want to regret. And I think as a hospice nurse, you've probably heard the regrets of the dying. I'm curious for you, working in this field and working around death and working with people at the end of life, what have you noticed? Has anything come up with people who have talked about the things that they wish they would have done?
I think the one that I hear the most that I don't hear other people say is that that most people on hospice regret not appreciating health. So I always hear people, like a lot of people will say, oh, they regret working too much or not saying what they wanted to say. And I do hear those too, but the most thing I hear is not appreciating and understanding how amazing it is to have like a healthy body. Like to be able to walk around and not have pain and not do this and just feel normal, right? Feel normal. Disease can really take that away from you. And yes, on hospice, we can do many things to help with that, but you still don't feel exactly like yourself, right? So I hear that a lot. So I always try to practice that. I think about death all the time on a daily basis, but it really helps me because the way I look at it is like, it helps me understand the present moment of how my body is healthy right now and how I'm so grateful that right now in this moment, I have a healthy body. For the most part.
How has that changed you? Working in this field, has it made you look at death differently than before you worked in hospice?
I've always had, possibly like you, I've always been like a seeker and I've never really feared death generally. I've always been into it and like wondering like, why are we here and where do we go? I've always had that prior to becoming a hospice nurse or any type of nurse. But hospice nursing specifically has helped me really like believe in the biology of death. Like there are many cool mystical things that happen and that I've witnessed at the end of life that also help and make me feel comforted. But generally speaking, even if none of those existed and I didn't see any of that, just the biology of dying and how I've witnessed over and over and over and over again, how our body helps us die and is built to do it, really has brought me comfort. Really, like being a hospice nurse has brought me so much comfort around the end of life. And I feel this might feel, I hope it doesn't sound insensitive. It's not meant to be, but I feel like people who get to die on hospice are really lucky. It's like a beautiful way to do it. If you're going, we're all going to do it. We're all going to die somehow, you know? And if I feel like it's a privilege to be able to know you're dying, to plan for it, and to have people manage your end of life. That's mostly what I've seen. Every once in a while, there's some crazy stuff that happens, but mostly it's a beautiful thing.
Okay, my mind's spinning. I want to take this like 2 or 3 different places. So when we think about the end of life, and oftentimes I've seen like a lot of TikTok videos on nurses who have talked about really amazing, weird, spiritual things that they've witnessed at the end of life, like loved ones calling out for, or like the person who's dying calling out for loved ones, or saying, I see my mom, or all of a sudden getting a lot of energy. I'm curious for you, has there been any amazing, crazy, weird things that have stuck out for you? And have you noticed any patterns that have made you think like, this can't just be a fluke? Like there's something happening here.
Girl, yes. I mean, hands down, like that's part of being a hospice nurse and I can't say I know what it means. I always try to stay very neutral in the sense of like what it means. I don't know what it means. I know we don't have answers for it, but I mean, seeing people vision is like a daily thing on hospice. Or if not daily, if you don't actually witness it yourself, it's families telling you or the patient telling you what happened. Where envisioning is where they see people who have already died. So their parents or their grandparents or a neighbor they loved or an old dog or cat that had died. And they're usually, the people who are seeing this are usually quite lucid. They're not even in like the actively dying phase. That's just a thing that happens. People see these things at the end of life. The rally where people have like the surge of energy, that happens in like one in three people. So like every third person will have this thing called the rally or the surge. The real name for it's called terminal lucidity. We don't know why it happens, but it's like they look like they're getting close to death. Then they have this burst of energy. They have a really great day. And then usually they die shortly after. So there's so many things. People deciding when they're going to die, people waiting for everyone to get into town, people waiting until their daughter gets married, waiting till everyone leaves the room. That's a big thing. Some people want to die alone, and their families are like plagued by it because they can't believe like we all were there for so long and then they waited and then we all left and they died alone. And whenever I hear that, I'm always like, I always want to make sure I tell them like most likely they tried to do that specifically. And usually people who are really independent, really private, really prideful, they want to be left alone when they die. I've seen, there's like the death reach, there's people calling out to people. Just the most amazing, beautiful things. And even if something like that's not happening, just watching someone take their last breath, I think because my grief is removed because it's not my loved one, right? Is like, if you can be present in that moment, it feels sacred. You don't have to be like religious or spiritual. I mean, I am spiritual, but you don't have to be to feel that as well. It feels just like a baby being born. You don't have to believe in anything, but if you watch a baby being born, it's hard not to be like, whoa, this new being is here and it's crying and it came from another human and this is wild. That is how it feels when someone takes their last breath, if you can be present. That's why I always want people, I'm sorry I'm getting long-winded, but I always want families to really be educated about how it looks and prepare themselves so they're not in this freak out mode and they can be still uncomfortable because they're losing their loved one, but so they don't miss that moment. It's still sad and devastating, but it can be really beautiful too, and a really special moment that they remember forever if they can be present.
I've noticed that a lot too when I worked in acute care in the hospital setting. I've had these families that, they would literally step out of the room to get coffee, and all of a sudden the patient dies. And I've seen that time and time again, or when the patient holds on, like, because the daughter needs to get there, or they need to say goodbye to their son, or their estranged child that they haven't spoken to in 5 years is on their way to say goodbye, and they hold on until that happens. And it's fascinating to me. And I do think that there's something more there at the end of life that we just don't quite understand. And that is happening with that. When you think about families and going through the grief process, or even somebody going through a process of knowing that they're getting close to death, how does somebody make peace with that?
I think everyone's a little different. I wish there was like a instant thing we can do. I think just generally speaking, from my experience, is the people who are willing to be honest and talk about what was going on with them, even if it was like what you would consider negative. I'm angry. I don't want to. I don't believe this. Even those things will help. So any kind of honesty, honest conversation about how they're feeling, what they think, what they want, any kind of preparation before, just speaking openly about what's going on with them, disease-wise, emotionally, physically, spiritually, all the things. So talking about it openly and honestly, with either healthcare workers or a social worker or your family, someone like safe that will allow them to have all of the emotions. I feel like there's something about truth that really helps people relax a little bit. Like, I think my book is called like Nothing to Fear, but I always say it's more normal to fear. So it's not about like getting to a place where like you just don't fear it. It's about saying you're afraid. That's all, and that almost helps you not be so afraid, I think. And then practical things you can do, I think that will help, are learning about how your disease will progress, learning about how doctors and nurses will help you along the way. Thinking about, if I'm gone in 6 months, how would I want these last 6 months to be spent? What would I want to be doing? Who would I want to be there? Like, truly asking yourself those things. I think we should do that whether we're sick or not, to really help shape our life. But it's all about planning, talking honestly. Honestly is the key. And education about what to expect at the end of life, specifically with your disease.
You mentioned planning. What are some things that you have noticed when it comes to regrets? Like, I should have done this. I should have planned this better. So if somebody's listening, they're like, yeah, you know what? My grandmother, my grandfather, me, I'm getting towards that last chapter of my life. What do I need to do?
The biggest thing is, which most people avoid because they don't think they have enough of it, is money. Plan people think, unless they have a lot of money and a lot of like an estate planning, they always think, oh, I don't have enough things to estate plan. That is not true. Basically, anyone dying should really speak to a lawyer and try to get things in order. Any money, any bank accounts, any houses you have in your name, anything, get it all planned with an estate planning lawyer, because that is very difficult for the people that love you once you die if it hasn't been done. So that's one plan. And then no one wants to do it because it is awful. Even me talking about it, I'm like, ugh, because I get it. It's just so unknown. You don't get it. You don't think you have enough things. That's only for people who have money. That's not true. And everyone should do it. Everyone should do it. And maybe you don't do much, but at least you went to a lawyer and you kind of got it figured out. Always have an advance directive. So very detailed advance directives about what you would want done in specific situations. So if you were to get in a bad accident and your brain is not working and you're living on machines, and they're asking your family, do you think he or she, do you think they'd want a feeding tube? You have it directly in your advanced directives already, whether you'd want a feeding tube or not. Do you want a trial period of a feeding tube? And making it be very, very detailed. So a lot of people don't do it because they're like, well, I don't know what I want. And I don't know. it can be as detailed as you need it to be. And that's going to take the pressure off your family who's already under an insane amount of stress. So you're never too young to get those things planned. And you can always change them as time goes on, right? So what you'd want at 35, 38, 45 might be different when you're 85, but you should still be doing it because shit happens. And having it all planned out will make it a hell of a lot easier for your family. And if it's hard to do, just think about your loved ones. If it's hard to do, think about your loved ones. You're doing it for them if you can't do it for yourself.
Did you guys know that I'm not only a therapist, but I'm also a coach and a professional tarot reader? Now, it's not exactly me hovering over a crystal ball telling your future. It's a way to connect with your guides on life issues such as career and love and spirituality. And sometimes people need one-on-one coaching to help them through breakups, toxic relationships, healing the mother wound, their spiritual path, or navigating tools as an empath. So I do all of these things to help my clients pursue life and decisions and understand themselves. So if you are interested in one-on-one coaching or a tarot reading, click the link below to get started. Okay, back to the podcast. I worked at the VA for a long time, and we did a lot of advanced directives. I cannot tell you guys how many times I have had somebody at the end of life or a really tough decision had to be made. And then there was like 2 or 3 children involved. And one child says, no, hospice care. Like, absolutely not. She wouldn't want this. We need to do hospice. That's the most ethical and best thing mom would want. Then you have this other child who is just like, absolutely not. I'm going to fight for her. We can still do this. I don't care if she's got to be on a ventilator. And by the time that they got it figured out legally, the patient passed without hospice care, without any type of treatment that she needed, because doctors and medical staff were stuck because we can't do anything if we don't have some kind of advance directive or agreement. And it really puts not only the patient in a difficult situation, but family members in a difficult situation. And now both of them have to live with that decision, lack of decision, for the rest of their lives. How easy is it to do an advance directive?
Easy. You don't even really need a lawyer. You can just download things online and do it yourself. And then you can always get it notarized if you want to, or take it into your doctor and have them sign it to get it witnessed. If you don't have a big like, it's always good to get it professionally notarized, right? To make it legal, I suppose. But generally speaking, if your family knows and you don't have a big family, or they're all on board, it's like, as long as people know, I think too, like, just make sure your loved ones know. Now, if you have a huge family, or there's a dynamic where there could be fighting and things like that, you probably should make it legal. But generally speaking, as long as people know, as long as it's written. But you can do a detailed advance directive where you can get it online, something called the 5 wishes you can do. There's a thing called a POLST, POLST, or MOLST, MOLST, depending on what state you're in, where it's just like a 4-box technically, where it's like you talk about if you'd want CPR or not, if you'd want to be intubated or not, if you'd want tube feeding or not, and then who would be the person that we should ask if you can't make these decisions. So it's real quick. That one's like a quick and easy, down and dirty, and you can get a doctor to sign it, and then you have that. It's not very detailed, but it is something.
What age should people be starting to think about these things?
I mean, I think we all should now. I mean, I guess of 18, because if you're not 18, then your family would be doing it. But I mean, I'm 40 or 41, and I already have one. My sister knows all of the things, and it'll change over time. It'll change over time, because right now I am still full code. If my heart stopped at a mall, I'd want CPR. I'd want to be on machines. But I do have in there specific things where it's like, if it's been X amount of time, then I wouldn't want it. Or if if EEGs of my brain are saying I'm brain dead, I wouldn't want it. Things like that. So it's very detailed, and I'm 41 and I did it.
You're young.
I'm young. I feel like everyone should do it. And then you redo it every few years, It's never too early, because like I said, accidents happen. I mean, I know I'm a hospice nurse, but I also was an ICU trauma nurse for many years, where it's like, your life and things can change in an instant. So you just never know. And these things could really, really change the trajectory of your family's life by having it done. It's just like, you don't understand the immense pressure your family would be under without those things versus if it was.
Your life can change in an instant.
Yeah.
What conversations do you think are important to have? Because I think, I think ego and pride can sometimes get in the way, and hurt and trauma and so many different things that can get in the way of not talking to people, not saying certain things, not making that phone call, not calling someone I love enough. Have you noticed at the end of life that there are regrets of, I should have said this, or I should have had this conversation? Or are there specific conversations that are important at the end of life, besides the advance directive?
Yeah, I think so. Yes, I do hear a lot of people say, I wish I would have, or like, I wish I would have not cared so much, or I wish about what people think, or about this or that, people's opinions. I wish I wouldn't have cared so much. I wish I wouldn't have been influenced so much. And like, I wish I would have made up with so-and-so sooner, or this doesn't matter, we should be talking, at the, so I hear that all the time. So generally speaking, another thing I always hear is like people being like, when should we tell people? When should I call people to come visit? I'm like, now, now, the time is now. The time is now. It's never like later. It's never like once they're more sick. No, do this now. You want to see your loved one before they're unconscious and almost gone, right? So if you're thinking about something, whether you're sick or not, you should, I think, get it all off your chest. If there's something to be said, say it. With a caveat, though, is, people die the way they lived. If you have like an emotionally immature parent who never was able to talk about how they felt, or was not a safe person to say how they're not going to suddenly become that just because they're dying. Unfortunately, they'll probably become worse. So you also have to take care of yourself in those instances. Not everyone dying is like suddenly able to be emotionally mature and have really difficult conversations just because they're dying. So it's like, it's difficult, right? It's not like a one size fits all thing. You still have to take care of yourself and know who's safe, who's not safe. But if you need to do it for yourself, do it for yourself. Does that make sense? Like if the person, even if they're not going to respond the way you, at least you could do it. At least, you said what you needed to say.
I've heard from a lot of people that not a big amount of the population, but I've dealt with a lot of patients when I worked in hospice who would say, my mom or my dad, they're just being so mean to me right now. Like, I'm trying to help them. I just want to make them comfortable, and they're being so mean, and it's hurting my feelings. Do you find that at the end of life, there are just things physically and mentally that are changing, or that the person may not fully be aware of everything that's happening?
Yeah, it depends on the disease usually. So sometimes it's disease oriented, like people with dementia or any kind of cognitive issues can sometimes get mean. So it could be because of the disease. It could be because they are sick. And when you're sick and you don't feel well, it's easy to be irritable and short-tempered. So that could be going on too. Those are usually the two things I see, is like, it's either disease related or it's how they feel. Like, so if someone's like totally cognitively there, but they're kind of nasty, usually I'll ask how they feel. Like, are they in a lot of pain? Because a lot of times people will like get used to the fact that they're in pain now, or like now they just don't feel good, and they don't go to a place of like, oh, maybe I should take medicine to like feel better. They will just like suffer in pain, and then it makes them really irritable, short-tempered. It just doesn't feel good to not feel good. And who do you take that out of? Who do you take that out on? Like the people that love you most, and then I come in the room, right? The nurse who's like barely there, they barely know, and they're nice as pie to me because I'm the stranger, So it's something to openly talk about. It is normal. I don't see it all the time, but it is very, very normal. And usually, that's why people on hospice really need to understand that it's like a family. Like hospice is for the family, like you said, there's social workers there, there's chaplains there. They're not just for the patient, they're for the family too. So we can do our best as nurses to try to manage the pain. So maybe they're not as irritable, but also the social worker can hopefully help talk to the patient, talk to the family, the chaplain. We're all there to try to take the load off a little bit. And sometimes it is like disease oriented and they don't know that they're just being jerks.
So what are some myths of hospice? Because I think that there are some stigmas around the word hospice care, and a lot of people may just think it's just pumping them with morphine and letting them die. So what are some stigmas and myths that you want people or feel that it's really important to know about hospice care?
Yes, the one about pumping them with morphine until they die is 100% false. 100% false. Yes, we do give morphine. Not everyone on hospice is on morphine. Most of the time when something like that happens, it's because the person has been in pain and dying anyway. Then they come on hospice and we give them morphine to keep them comfortable, and then they die. And then people are like, you gave them morphine and they died. And the truth of the matter is whether they were on hospice or not, or getting morphine or not, they were going to die. And what we did was help them die more comfortably. There's actually been studies proven that the amount of morphine we usually give in hospice doesn't make anyone die quicker in hospice. They just die more peacefully. And generally speaking, I feel like hospice is a program about living, not about dying. I truly believe that, because I think what people think is they can deny death at all costs and maybe we won't die, which is not true. There comes a point in everyone's like end of life journey where like, we know this is happening. So if we know this, what can help you? And I really feel like hospice is a program to help you live out the rest of your life, not to help you die. It's about like, you're not dead yet, but you're going to be because of this disease. We know that. That's a fact. And I think a lot of people try to, including other healthcare workers, which is what's irritating to me. We try to help people deny the fact that they're dying. Like, maybe it won't. We never really know, which I get the sentiment there, but really I want to be like, we're healthcare workers. This is a specific disease that we see day in and day out. We see where they are in the progression of that disease. We do know. They're going to die probably in the next 6 months. We really do know that, whether we put them on hospice or not. So hospice, if you go on hospice, it's about living out the rest of that time, about getting enough medication so you feel good, so you feel better, so you can be with your family, not spend time at the hospital, not spend time getting your blood drawn and tests done and this and for no reason really, because it's not going to help. So I get really passionate about it because I feel like we do people a disservice in the healthcare world when we're not like brutally honest. We're so uncomfortable being like, yeah, you're going to die in 6 months. No one wants to say that. They want to go, well, you don't really know. We don't really know. And I get it. But all the people hang on to is we don't really know. So then they keep doing all these things and then don't live out the rest of their life. They are in a hospital, they're getting sick, or they're trying to this thing and this thing. They usually die sooner. There are many diseases where people die sooner because they didn't stop treatment. They would have lived longer if there actually have been, I'll finish with this. There actually has been studies where certain diseases, specific lung cancers and different things, that they did studies about people who went on hospice versus people who didn't. And people who went on hospice with the same disease lived longer, didn't just get pumped with morphine to die.
I love that. And it's such I love that you're passionate, because we need people in this field who are passionate. But you're absolutely right about the discomfort with talking about death. I cannot tell you how many times I've witnessed doctors who are very uncomfortable giving that news that your dad is going to die, your mom is going to die. I have a very traumatic time in my career that I will never forget, and I'm like, I will never be in this position again, where I had a doctor. I don't know how this happened, but I was like a brand new social worker. I wasn't even licensed. I was working in a hospital, and he says, you need to call the daughter. Dad is dying and he maybe only has a couple hours. You need to call her and tell her that and get her here. And when I called the daughter, she was hysterical because no one had talked to her about the fact that there was a possibility that her dad could die. And now here I am giving the news of, hey, your dad doesn't have much longer to live. And I told myself I'll never be in that position again because it's not in my scope to give that information. Right. And I'll never forget how uncomfortable this doctor was with talking about death. And it really did a disservice to the family. It did a disservice to the patient. And it did a disservice to me because it put everybody in this like crazy situation where I couldn't even help the daughter help her to understand what was going on. And I think that we have a society that, like you said in your book, death is a dirty word, but it doesn't have to be, right? So when you say that death is not a dirty word, elaborate on that.
It's like we want to sugarcoat it a bit with, I get how like passed away makes everyone feel a little more comfortable. It doesn't feel as harsh saying like my so-and-so's dead, so-and-so's dying, so-and-so has died. So much so that we've turned it into when you do say that, it sounds harsh. Like every time I say it on any of my videos, death, dying, like why don't we say death, dying, died, dead? People will say, oh, it just sounds so harsh. It sounds so harsh because we don't say it. It's not a dirty word. We are all going to die. Just because we don't say something doesn't mean it's not going to happen. We need to start living in a world where we understand that we die. And I feel like by understanding that, by speaking those words, by talking about death, by realizing that we all are going to go through this, it will help us live better. And if we live better, we die better. From my experience, people who are willing and able to embrace that any way they can, whether it's like learning about it or talking about it or discussing what they think it will be like or what they think comes after this, if anything, talking about all of that stuff, talking about the fear around it, there's something about that can be relieving. Like I'm not the one who said what we resist persists, right? But there is something about like resisting that I think makes it even more fearful. So to me, talking about like, death is not a dirty word, meaning we can talk about it in any way, shape, or form. I think that will truly help us live better.
What has this taught you about grief?
I don't know. What has it taught me about grief? I think grief can come in all forms, not just because someone died. And especially in hospice, grief is ever existing, even before someone dies. So anticipatory grief is such a huge thing in hospice care. And whether or any kind of life-limiting illness, there is like multiple layers of grief, multiple versions of grief. I think people get really confused and shamed and guilted by the feeling of grief and the different feelings they feel throughout this process of death. So many family members of mine with dying patients will, they're not dead yet. And they'll be like, when's this going to be over? When's this going to happen? Because it's so hard to sit in that unknowing of like, they're still here, but not really, but they haven't died yet. And there's grief in that. And it's so uncomfortable that they're kind of like, can we hurry this up? And then they feel guilty for thinking that way. So the only thing I've really learned about grief is that it's complicated. It's complicated and uncomfortable. And I think as a society, generally speaking, we're really uncomfortable with being uncomfortable, with feeling it ourselves, being around people who are feeling it. We do all we can to try not to feel it. And I think it just really creates this perpetual problem of resisting things. But I think it's changing. I mean, I think there's a reason why there are many accounts like mine where people are willing to listen. And there's a lot of grief accounts, and there's a lot of accounts, meaning online. Like there's a reason why people online who are talking about this, people are listening and they're gaining an audience. Because I think we all know that like something needs to change. and people are going through it enough now. I mean, they've always have, but like where they're kind of like, whoa, they're like, I know that many people that talk to me are like, there's nothing out there to help us, to talk to us. And I think people are starting to kind of slowly pop up as a community to help each other, which has been great.
Thanks to accounts like yours. I mean, I think that takes a lot of bravery and courage to A, get in front of a camera, and B, to be able to talk about the topics that are very stigmatized, that are uncomfortable to talk about. But somebody needs to do it, right? To be able to create a platform to say, hey, you know what, this does happen. And what you're feeling is common, and you're not broken. And this is what the process looks like. This is what you can expect. And I think there is some comfort knowing that, okay, oh, this is what's supposed to happen. These are the things that I can make it easier to deal with, or to at least make the process better. And so the things that you're doing on camera, off camera, so important. And I have a question for you. When you die, how do you want to be remembered?
How do I want to be remembered? I hope this is so funny because I'm like, oh, I'm going to be really old and everyone I know is going to be dead already. That's exactly what I thought. So I can't wait to see them. Right. I always think about like what it's going to be like when I die, and like, and that type of thing. But I think I'd want to be remembered as someone who said the truth, was loving, had the ability to like make people feel comfortable in themselves, and just like as a helpful person. I mean, I don't feel like, I think about like my family and my nieces and things like that. I hope that when I die that I've helped them feel loved. What's that saying about like people don't remember what you say, they remember like how you made them feel? That's what I want. I want people to remember. I hope they feel like I've made them feel good.
Are you a Cancer by chance? What's your sign?
No, I'm a Scorpio.
You are a Scorpio. Okay, I was going to say that next. I'm like, she's got to be a water sign. But it's just a side note. That was very beautiful, but that's so Scorpio. Like the mindset of, oh, everyone's probably are going to be dead. And like the fact that you think about death a lot. I have a lot of Scorpio in my chart, and I'm right at the cusp of Libra and Scorpio. We're very Scorpio.
Yeah. Oh my gosh, that's great.
But
great.
It takes a very special kind of person to be able to think about death in the way that you do. So thank you so much for continuing to create this platform to talk about these subjects that are so important. And thank you for coming on the show today.
Thank you. Thanks for having me.
Okay. And before we leave, actually, because I want to put this in as well, is there anything that you're working on? Where can people find you, and any projects that you're working on that you want to tell people about?
That's great. So they can find me anywhere they get their social media at Hospice Nurse Julie. My favorite right now is my YouTube, which is also Hospice Nurse Julie, but there's just longer videos there. I go live there. So if you're really looking to like dig into the information, my YouTube channel at Hospice Nurse Julie. My book is out, Nothing to Fear. I'm working on a workbook that's coming up, but that won't be out for a while.
Okay, great. Well, we'll link everything at the bottom in the show notes so you guys can get a hold of Julie, grab her book, and till the next time, see you on the next episode of Diary of an Empath.